Hello, and welcome to another episode of the Neurology Lounge podcast, and I'm Ibrahim Imam. The title today is 10 Important Things to Know About Rabies. Rabies is anything but a mundane infection. It is a disease that is steeped in folklore and seared in the human imagination. It fills everyone with dread, and it evokes the most primal of human responses. This is because of some of the extremely distressing symptoms that rabies provokes. It is such a horrifying infection that every single fact about rabies is worthy of note. Let us therefore count down the 10 extremely important things to know about this violent infection. Number 1, transmission. Rabies is a lyssavirus, a form of rhabdovirus, and it is transmitted by direct animal bites or saliva contamination of wounds. The transmitting animals range from dogs, cats, foxes, jackals, and wolves to bats, mongooses, raccoons, and skunks. Human-to-human transmission is, however, also possible. Number 2, its pathology. The distinctive pathological feature of rabies are pink or eosinophilic bodies that are seen inside the neurons of the brain. These bodies are called Negri bodies because of their black color. Negri bodies are round or oval, and they are sharply demarcated, and they are mostly found in the pyramidal cells of the hippocampus and cortex, and in the Purkinje cells of the cerebellum, the little brain at the back of the big brain. Number 3, types. There are two main types of rabies. The first is encephalitic or furious rabies, and this accounts for 80% of cases. The second is paralytic or dumb rabies, and this constitutes 20% of cases of rabies. Number 4, early features. The typical calling cards of rabies infection are headache, fever, muscle aches, and irritability. Rabies also presents early with tingling or paresthesias at the site of the animal bite, and this can progress to muscle twitching or fasciculations. Number 5, the defining features. Rabies is famously known for causing hydrophobia. This is the fear of swallowing water, and this manifests with painful laryngeal spasms when trying to breathe in. Rabies may also cause excessive activity of the autonomic nervous system, and amongst the distressing presentations of this are excessive sweating, excessive salivation, and fluctuations in the blood pressure. The later features of rabies include aggressive behavior, anxiety, paranoia, delusions, hallucinations, insomnia, altered consciousness, delirium, and eventually coma. Number 6, distinctive sexual manifestations. The sexual manifestations of rabies are varied and intriguing. The most prominent is priapism, and this is a painful, sustained penile erection. Rabies may also present with excessive libido, hypersexuality, nymphomania, penile pain, penile hyperexcitability, and recurrent ejaculation. Number 7, the major mimics of rabies. Rabies may be mistaken, at least in the early stages, with several other disorders, and at the top of this are schizophrenia, delirium tremens from alcohol withdrawal, acute psychosis, hypomania, tetanus, paralytic polio, Guillain-Barré syndrome, botulism, diphtheria, and even hysteria. Number 8, investigations. The MRI scan in rabies shows abnormal signal changes in many areas of the brain and the spinal cord. And the spinal fluid analysis shows a raised count of lymphocytes, and it may also show the rabies RNA and antibodies to rabies. Rabies RNA may also be found in the saliva, in extracted hair follicles, in the skin tissue from the nape of the neck, and in the urine. Number 9, prevention. Pre-exposure vaccination is indicated for several groups. The first are close contacts, such as relatives and hospital staff. The second are high-risk professionals, such as animal handlers and laboratory workers. And the third are travelers to endemic areas. And number 10, treatment. Supportive treatment for people with rabies includes barrier nursing and wound care. Sedation is also required, usually with benzodiazepines, barbiturates, and intravenous morphine. Antiviral treatment may be in the form of ribavirin, interferon alpha, and the human rabies immunoglobulin, or HRIG. Favipiravir is an investigational antiviral agent. The Milwaukee Protocol has been used, and this consists of ketamine, midazolam, and nimodipine. Recent studies, however, suggest that this is not as effective as earlier hyped. Thank you very much for watching or listening to this podcast. Please click on the like button and subscribe to the channel so that you don't miss the next episode. Whilst waiting for that, why not check out my book called Surfing the Brain, and why not look at my website called Neuro Checklist. Thank you very much for your time.